Hey, Dr. C here with you. So this is going to be all about thyroid-related hair loss and solutions for that, specifically nutraceutical solutions. And I've got to say, this is one of the most troubling symptoms around, from thyroid disease or from whatever else. And it's a big deal. It's frustrating emotionally. It's a big thing in terms of just confidence in one's appearance. But it also shows that something is wrong, that the body is not fixing itself properly. I think about parts of the body as being different types of little cells, and there's always old ones that are breaking down and new ones coming back. But when the new ones don't come back quickly enough, the body just wears itself out and it breaks down and it degenerates. And one of the more visible versions of that is hair loss. And this is so common with thyroid disease. We see this with all forms as well. So hyperthyroidism, Hashimoto's hypothyroidism, all of these can be associated with significant amounts of hair loss. And the stats are pretty high. Data suggests that somewhere around half of people to a third of people with any version of thyroid disease have noticeable, worrisome hair loss. Half to a third. And it doesn't matter what kind of thyroid disease it is, even if medication is being used incorrectly, that can do it as well. Even when levels are normal, that can be an issue. And why is this so tightly connected? Well, your thyroid does a couple of main things. First one is that it controls energy output, so that's body weight, that's fatigue. It also controls nerve conduction, so that's things like mood, memory, tremors, fine motor control, things like that. The most relevant of the things that it does here is it affects growth cycles. So every cell in the body, every part of the body is undergoing different cycles of growth. And there's cycles of growth and dormancy and signals that control that, and proteins that govern that as well. And these things are being governed by many factors, but thyroid hormones are among the most central of them. So the core issue is that you can have the wrong amount of thyroid hormones, you can have the wrong proportions of thyroid hormones, they can be used incorrectly within the cells, and there can be inflammation from the autoimmune attack, or some combination of all that. But any of those things can be big drivers for making hair thin abnormally and to delay its growth and its recurrence. Now, when it's occurring from thyroid disease, there's three main versions of hair loss that can go on. I'm going to touch on each of the three of these. The important point here is that knowing the three patterns that occur tell us what are the mechanisms, what are the processes going on. And the more we know about that, the more we can talk about solutions, ways to help reverse those processes and help hair growth come back healthy again. First is telogen effluvium. This is the most common. We suspect this when hair loss is pretty even, diffuse, and then gradual. What's happening here is that hair follicles just enter the resting stage, the telogen phase, and that means there's a lot of shedding but less growth. This can tie to certain nutrient deficiencies, but it's the most common version we see with thyroid disease. And the next most common is androgenetic alopecia. So the name itself, alopecia, just means hair loss. Androgenetic is referring to androgen. So not genetic like genetics like genes, but androgens. Those are male-like hormones. And the connection here is that thyroid levels not being right can cause altered amounts of male-like hormones and also a different response to male-like hormones. Our biggest factor here is one called DHT. That's dihydrotestosterone. This is a normal byproduct from testosterone. There's some also made from DHEA, one of the adrenal hormones. But if the amounts that are made are excessive, or if the body has an exaggerated response to it, then this inhibits the formation of proteins that build hair, specifically keratin. So extra DHT blocks the formation of keratin. Hair cannot regrow. It's not so much that it triggers loss, but that it stops regrowth. And it can look the same, but it's a different mechanism. We think more about this when hair loss is occurring in certain parts of the head more so than others. So especially forehead, top center. This can also occur with other androgenic symptoms like oilier skin or acne, but this is androgenetic alopecia. Last off, this is the most rare one, but it does happen. This is alopecia areata. And areata means total. So this is hair loss that's pretty complete. And this is an autoimmune reaction. Now, autoimmune disease, if you get one, you get higher odds of having others, unfortunately. So when this one forms, the immune system attacks the hair follicles themselves. And it does that by generating free radicals that kill them off. Now, the immune system should do that when it's killing off bacteria or viruses, but it can do that against things like your hair follicles as well. Now, alopecia areata, it's more complete hair loss and it's more extensive hair loss. So not all cases are 100%, but many of them are pretty close to it. It can be even loss of eyebrows, even loss of eyelashes. I've had friends who've had this and many patients that have had this, and it can be complete, like there's no hair anywhere. And this is one that's more dramatic and more distinct, but also one of the more rare ones. Now I want to talk about the mechanisms. So with thyroid disease, that can be one of the triggers that makes hair loss happen. But when it does, there's things going on behind the scenes. And again, this is going to open up natural treatment options for us by understanding these. So the main ones occur when there's errors in the signals to follicles to enter their active stage, anagen. They've got anagen and telogen. So one big problem is that they're not going into the active anagen stage. Next common thing is that they just die early before they should, which is called apoptosis. We can also see free radical damage that can be related to the immune system or other causes as well. Extra amounts of dihydrotestosterone, inflammation, low amount of nutrients, and poor production of keratin. So those are the main ways that things go wrong. And the cool thing is that whenever possible, of course, whenever there's any chance at all, you want to know the main cause. You want to make sure your thyroid is doing better and address the hypothyroidism, address the hyperthyroidism. Make sure your antibodies are controlled, brought back down to a safer range. Make sure that you're not on medication unnecessarily, that you're not on excessive amounts of it. And as you're doing those things, it's also great to address these causes. You can do safe things to help reverse these causes of hair growth. And this is where nutraceuticals have a lot to offer. Now, I talked before about those mechanisms of hair loss, so we can reverse most of those. The right nutraceuticals can help hair follicles go back to their anagen stage. It can help your body clear DHT more effectively. They can reduce inflammation. They can make up for nutrient deficiencies. They can help keratin grow more effectively. And nice thing is that a lot of things that do that have good bodies of data behind them. So the ones I'm going to talk about now, these are ones that were thoroughly analyzed. They're all things that are safe for those with thyroid disease. They're safe overall. We know they work based upon high-quality, placebo-controlled human studies, and specifically providing benefits for those with thyroid-related hair loss. I went through the literature and honed down on these couple of items, and I wanted to put them together into a blend to make hair regrowth easier and to make it a simple way to stop loss and get healthy hair back again. First one I mentioned is saw palmetto, also called Renua repens. So this is an extract from the berries of a kind of a palm tree. And it's funny, it's had a long history for treating prostate disorders in men, but there's a lot of good data about it helping hair health in women and men. And the reason for that connection is that a lot of things go badly in the prostate when dihydrotestosterone is not metabolized properly. When it's formed in high amounts or not broken down right, it can create problems in the prostate. Now, this is the exact same sort of thing that can go on within hair follicles. So men have more testosterone than women, so they're more apt to have hormonal hair loss. But women's bodies still make testosterone. And in both genders, it's not even a matter of simply too much testosterone, it's more a matter of how the hair follicles react to it. The connection with saw palmetto is that this plant helps to block an enzyme that makes testosterone into dihydrotestosterone. The enzyme is called 5-alpha reductase. It also makes dihydrotestosterone less apt to cause problems, less apt to bind to those receptors, less apt to damage the follicles, and to cause fewer issues. Now, what really matters is the data that we have from clinical trials, and I'll touch on that for all these ingredients. Clinical trials have shown that with hair loss from androgenetic alopecia and telogen effluvium, roughly 60%, 60%, see improvements in hair quality. About a third see increased overall hair count. Over 80% saw more hair density, and more than half saw their hair loss stop. In terms of thyroid disease, thyroid considerations, really no negatives, no big drawbacks with saw palmetto and thyroid disease. Next one to mention is called Pygium or Pygium africanum. This is similar to saw palmetto in that it's also been used as affecting DHT metabolism. And it does that like it does, but specifically it blocks the effect of DHT on hurting hair follicles and making follicles shrink. So part of it is that DHT can make follicles not go into their active stage, but part of it is they just make them smaller. They make the follicles themselves actually decrease in size. And this has been shown to be one of the biggest problems in female pattern baldness. So in studies, we know that Pygium can block DHT receptors by more than 60%. In terms of thyroid disease, no negative issues, not a source of iodine, no drawbacks, safe thing overall. Next to mention is common bamboo. The genus and species here are Bambusa vulgaris. This is an extract from the bamboo plant, and it's the inner bark that's used. Now, the benefits to bamboo mostly equate to it as a source of silica, as an organically bound source of silica. Silica is a trace mineral, and it's been shown to be helpful in collagen production and also keratin formation. So silica gives keratin a boost and makes it stronger. That causes the hair shafts to be thicker, more resilient, and less apt to be damaged from heat, pollution, or styling. Over time, that makes hair just thicker, more durable, and less apt to break prematurely. And not just silica, bamboo is also a good source of some key amino acids, some vitamin C, and some antioxidants. In clinical trials, silica extracts have been shown in placebo studies to cause thickness to thinner hair, to cause measurable increases in elasticity, to make them more resistant to breakage, and to make the hair shafts thicker. And all these results that showed up were not ones that were shown in the placebo group. They were exclusive to those taking the active bamboo, even when no one knew which one they were taking. Thyroid considerations, I've thought about this. There is data saying that bamboo shoots, when given to rats in pretty whopping doses, may slow thyroid function. And that's because bamboo shoots have some glucosides such as thiocyanate. That's a naturally occurring thing in a lot of cruciferous plants and vegetables. But here's the deal. Bambusa vulgaris is not the same as bamboo shoots. They've got the same name, but they're not the same species. And the Bambusa vulgaris I've used does not contain thiocyanates, so no negatives about thyroid function. It's important to have a good amount of silica. I've targeted at least 70% silica in these. Next to mention are tocotrienols. These are pretty neat. These are fat-soluble antioxidants in the vitamin E family. They're not as common in the diet as tocopherols, like other vitamin E's, but they're good for the body. They're quite useful. Specifically, they are antioxidants that help protect the scalp and hair follicles from oxidative stress. By neutralizing free radicals, they can help maintain healthy hair growth and reduce damage caused by UV rays, pollution, cosmetic products that are used on the hair. And we see this from clinical trials. In high-quality human studies, tocotrienols were shown to increase hair count by 34% within just several months. And this was over placebo use. So hair got 30 to 40% denser with just a few months. Now, I'm talking through a lot of ingredients, and I want you to think about these things stacking. All these benefits, any one is awesome by itself, but we're thinking about the cumulative effect of those. And that's one of the big powers of nutraceuticals. We can combine them. We're using synergistic different mechanisms of action. So all those bad things that happen that hurt hair, we can target all of those, make sure it comes back better again. Next to mention is zinc. This is a trace mineral, a commonly known nutrient. It's a big part of maintaining healthy hair growth and connective tissue growth. And it's simply a nutrient needed for those various cofactors. There's also data saying that creative, healthy amounts of it regulate the sebaceous glands, and that decreases follicle clogging and also lowers the negative effects of normal androgens. We have clinical trials, blinded trials, showing that appropriate zinc supplementation can improve hair density and reduce hair loss. Relative to thyroid considerations, no drawbacks. Now, zinc is like all nutrients, it's possible to get amounts that are excessive, but I've thought that through, and the amounts that you'll find in this supplement combine well with Thyroid Daily and all the other supplements that I've made. It won't become excessive. Another nutrient to mention is biotin. This one's had a lot of press about being like the hair growth vitamin, and there's some truth to it. It's a critical part of keratin formation. It's also known to be relevant to strengthening hair, reducing breakage, and helping hair growth. And we've seen this in clinical trials. So high-quality clinical studies have shown that it can improve hair thickness, shine, and scalp coverage in those with thinning hair. And it's important to know that biotin is safe for thyroid function. I've talked a lot about taking time off from biotin before getting thyroid tests done, and it's a distinction between what biotin does in your body and what happens in a laboratory. So if you take biotin right before getting a blood test, the free form of biotin that your body hasn't yet metabolized, it's disrupting what's being done in the laboratory, because a lot of laboratory tests use enzymes called biotinidase. So if you've got a lot of biotin, it makes the test results different. Now, it doesn't mean that the biotin's hurting you. It just means that it changes things on the test panels. So always give yourself at least 3 days between any supplements with biotin and getting blood tests done. But good data that appropriate amounts of it can help hair growth and improvements. Next to mention is cysteine. This is one of the many sulfur-containing amino acids that's important for keratin formation. Specifically, cysteine is part of making bonds in hair that prevent it from breaking. When the body doesn't use cysteine right, then hair is just too fragile and breaks off and falls off and doesn't grow back appropriately. A recent clinical trial of 12 weeks was done on those with telogen effluvium. And what they showed, one group was given cysteine, one group was given a placebo. And the group on cysteine had clear improvements in hair growth within the first 12 weeks. Half saw that very dramatically. Relative to thyroid function, no concerns here. Cysteine is not a source of iodine, no real negatives with thyroid function at all. Naturally occurring amino acid we get in a lot of our foods. Related is lysine. This is also one that's important for collagen formation, and it's also relevant for calcium absorption. Many diets can run low in lysine, and if the body is lacking in that, that can also have negative effects upon the overall immune response. And one more connection, lysine is important for iron absorption. And I'll talk a bit more about that, but iron's a big part of healthy hair. Specific clinical trials have shown that lysine supplementation can prevent hair breakage, make the strands of hair thicker, and also increase the shine in hair. And there's objective ways of measuring that. No real negative things about lysine and thyroid function. Now, another amino acid to mention is methionine. This is another sulfur-containing amino acid like cysteine, and this acts as a precursor to cysteine. So the two together work in combination for the formation of keratin, and that's the main protein that goes into hair. So clinical trials have supported its use. This is especially relevant for androgenic alopecia. So in cases where there's a hormonal issue behind hair loss. Trials have shown that supplementing with methionine can diminish the negative effect that hormonal changes can have upon hair loss. And this is especially important during perimenopause and menopause. Another nutrient to mention here is vitamin B5, also known as pantothenic acid. This is critical for numerous parts of the body's normal chemistry, including hair formation. And specifically, this is most important in the scalp. So B5 helps the scalp make the oils that make hair healthy. And clinical trials have confirmed this. It's been shown that appropriate amounts of B5 can cause fewer split ends, better hair texture, and better hydration of hair. More moisture within the shaft of hair itself. Relative to thyroid disease, no drawbacks, no big negatives. A safe thing for thyroid function. Next ingredient worth mentioning is sodium hyaluronate. This is related to hyaluronic acid, and this is something that helps with scalp hydration as well. It also makes the scalp's skin more elastic, and that can also prevent hair breakage and maintain healthy follicle growth. Clinical trials have shown that it can make hair more manageable, softer, and also reduce scalp dryness and scalp irritation. And like all these ingredients, no drawbacks, no negatives about thyroid health. A couple more to mention, pumpkin seed powder. So good data on this, and this is quite simply powder from pumpkin seeds. This has got a lot of important nutrients, zinc, magnesium, essential fats, but there's also some unique things in pumpkin seeds that also act on DHT. In some ways that are similar to saw palmetto and pygeum, but in other ways that are complementary. One clinical trial showed that supplementing with pumpkin seed powder can cause as much as a 40% increase in hair count within just 24 weeks. And this was above and beyond what was shown to occur in the same group on placebo. So it can act on DHT metabolism and be a benefit for androgenic alopecia and also thyroid-related hair thinning. So I've combined these together into a new blend, and I've called this Renua. So like renewal, rejuvenation, things along those lines. And this is specifically for thyroid-related hair loss. Quite simply, it works best to take 2 of these daily with a meal. And this can be taken as soon as an hour after thyroid medication for those who are on it. Now, with hair growth, we got to think about time frames. So hair follicles go into cycles of activity and dormancy on a 3 to 6 month time frame. So given that, it's important to think about treating hair growth for at least a year. You can often see a reduction in hair loss in the first several months. That's a really good sign. Sometimes some new growth occurring in the first several months, but full benefits often do take 6 to 12 to 18 months for clear positive changes. Renua has no known interactions with common medications, especially those that are acting upon thyroid hormones. But as all things, make your doctor aware of anything that you're taking if you are on prescription medications. Allergies, no big common ones, no real common ones, but any plant can cause reactions to those who may be sensitive to them. In terms of how to pair this with products, so Renua should always go along with Thyroid Daily. That's a comprehensive thyroid-specific multi that fills in just all the nutrient gaps that are important for general health as well as hair health. It's good to pair also with Omega Pure. There's a lot of ways that omega-3 fats are important for hair growth. And last one to think about is Easy Iron. In many cases, low iron can be a big driver of hair loss, especially telogen effluvium. Easy Iron is bioavailable, well-tolerated, and made for those with thyroid disease. So please know your iron status and treat that if needed. If your iron levels are normal, you can still have hair loss, but in those cases, iron supplementation would not be appropriate. And that's why I didn't put iron in this mixture. So to wrap this up, hair loss is a big deal, super distressing, frustrating, and a clear sign of the body not working right. But please know that there are safe ways to reverse all these mechanisms of hair loss. So always find and treat the cause when possible, but along the way, you can still make a difference. You can still lower the oxidative stress, you can reduce the inflammation, you can help the body respond better to hormones, and you can get those cycles of telogen and anagen back in line again. Hair can come back, hair can become healthy again for nearly all people. That's the promise behind Renua, and that's the goal behind formulating that. Dr. Alan Christianson here with you. Take great care, and we'll talk again soon.